Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hey there, and welcome to this week's episode of the podcast. It's always a pleasure to have you along with me for Anti-Aging Insights. Today, we are talking about a topic that I've never spoken about in the podcast, and that is thread lifts, in particular the Instalift type. There are a number of different types of thread lifts, and the one that I offer currently at the clinic is Instalift. And so I'm really excited to tell you a little bit about it. I want to help you become a little bit more informed about thread lifts so that you can make a decision as to whether or not this is the right procedure for you. So let's get right into it and talk a little bit about what is a thread lift and why would someone consider getting a thread lift? Well, first of all, let's tackle the why. The reason to get a thread lift treatment is simply to help elevate and reposition the facial tissues. In other words, as we get older, we tend to lose some of the volume in the fat pads in our midface, and we also tend to develop some sagging as gravity starts to pull down some of the tissues. A very common thing that people observe are the jowls down along the bottom of the jawline. And this is a very typical feature of aging. Imagine if there was some way that you can magically pull up on those tissues so that you have this more youthful look of your skin, a tighter looking skin, essentially doing a facelift, but without the surgery. Well, that is exactly what a thread lift does. And the way the thread lift works is it literally is a dissolvable suture. And through various techniques, we are able to insert that in the skin and tighten that suture so that it literally is pulling up on the skin and it creates a lifting appearance of the skin. Quite dramatic results, and these results are instant. So I'm going to get into a little bit more of the procedure in a moment. I want to talk a little bit more about what a thread is made of, and then I'll explain a little bit more about how we actually do the procedure. So when it comes to threads, as I mentioned, there are different types. The one that I offer right now at the clinic is the Silhouette Instalift thread. And this consists of a resorbable suture. So over time, your body does gradually break it down. And the main component in this is poly-L-lactide co-glycolide. This is very similar to a product known as Sculptra. If you're familiar with Sculptra, you'll know that it is a type of filler that we inject in the skin. And this causes collagen stimulation. This is exactly another way that threads work. So threads actually have two different functions. In addition to the lifting that I just described, they also stimulate collagen. So you get long-term effect from this as well by creating more collagen in the skin, which again is something that we lose as we are aging. So to summarize, when you get a thread lift, you are getting the mechanical lift from the actual suture. And you're also getting some regeneration of collagen due to the biostimulatory properties of the thread. Now, how does this actually work in terms of the procedure? Well, it's a very simple procedure. It's done in the office. It usually takes less than an hour. What we would do is use some local anesthetic, similar to what you would get if you went to the dentist for a filling. We inject a little bit of this local anesthetic into a couple different places in the face where the threads are going to go in. We typically would do about 5 threads at a time per side. It could be a little bit less, could be a little bit more, depending on the person and the assessment of the face and what needs to be done. Once those areas are frozen, we map out where we want to get the most lift. And using a little bit of physics, we figure out where the vectors would lie in terms of getting that lift. The vector is really a fancy way of saying the straight line where we want the force of the lift to happen on your face. Once we've done that, and the skin is frozen, we then insert the suture and anchor it at the bottom. And then we insert the suture and anchor it at the top. And literally then, by pulling on that suture, we can see instant lift of the skin. It's quite dramatic, and it's extremely satisfying as a clinician, as a person that does this procedure, to see that immediately. The really nice thing about this is it's done in one office visit. As I mentioned, usually takes less than an hour, and there is not a lot of downtime. Really, you're going to have a few punctures in the skin where the thread has been inserted. One of the risks is a little bit of bleeding, a little bit of bruising in the area. And you can also get slight dimpling of the skin when the thread is tightened, which typically then will go away relatively quickly within a couple of days. The main thing that I always tell patients about and we want to watch out for is infection. And this is something that we minimize by cleaning the skin extremely well whenever we do such a treatment. And so that is what a thread lift is in a nutshell. It is a dissolvable suture that gets placed under the skin once it is frozen. It pulls up mechanically on the sagging skin, creates a lifting effect, creates a tightening effect, and then the suture itself is made of a biostimulatory agent that then produces more collagen in the region. These typically last about 2 years or so as far as the suture itself before the body breaks it down and dissolves it. And then you may want to consider doing again. Of course, there is a lot of skill involved with doing this type of treatment. There is a lot of assessment that is done in the face to determine where these threads go, how many threads to use. And just like filler, just like neuromodulator, it's really important to see somebody that has experience with this and knows how to do these assessments to get the best possible effect for you and to make sure that it is done in a safe manner. So there you have it, the science behind the Instalift thread lifts. If you're intrigued, do your homework. I absolutely encourage you to do that. And then don't hesitate to reach out to a trusted professional. Of course, if you want to come in and discuss this with me, I'm delighted to be able to have that conversation with you. Feel free to reach out to me. And as always, you can check out my Instagram page at Dr. Teri Fisher, DrTeriFisher. And in fact, if you're listening to this podcast around the time that it is being released, March 5th, just recently on my Instagram, I posted a before and after picture. In particular, I have one patient that I did an Instalift procedure on just recently, and I think the results were quite dramatic. And of course, feel free to check that out. You can always reach me on my website, drterifisher.com, and through anti-aging at antiagingvancouver.com. Thank you again for tuning in. I have some really, really exciting news for a new major project that I'm working on, which I will be able to reveal very shortly. I'm not quite there yet, but as soon as I can, I will let you know. And I'm really excited about it, and I think you'll enjoy it as well. So there you go. Thanks once again for tuning in. Be well. Talk to you again soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.